Matters of public-private partnership, public-private dialogue, public-private engagement, they're very confusing to a lot of people. But it tends to also be very complex language because it almost always goes back to legislation. And so our interactions with a lot of people working in the public-private sector space, particularly whenever we have conversations around bringing them together, there's always a lot of fear because they don't understand the policy, legal and regulatory framework, but they also just don't know where to get the information easily. And even if they get any information, they just don't know how to read, interpret it, and use it to develop meaningful dialogue, engagement, or collaborations, or even partnerships, PPPs as we call them. So we developed the popular version to democratize public-private partnerships. Simple document, 20 pages, just laying it out. What are the important things whenever you're thinking about public-private collaboration? PPPs, public-private partnerships, are very structural collaborations that are guided by the PPP Act. And they tend to have a very rigid structure in how they are developed, how they are justified, how they are funded, how they are managed as contracts. A lot of people in healthcare have always felt a bit left out. They don't naturally fit with healthcare because healthcare is very heavy on services. So the PPP Act works better for infrastructure projects. And so because of that, the Ministry of Health and a lot of partners came together and developed what is called a public-private collaboration strategy. So we use the word PPC rather than PPP in healthcare in Kenya. So the popular version that we've developed is the PPC popular version that breaks down all these complexities. PPCs include the traditional PPPs, but also includes other forms of partnerships or arrangements, things like sharing of staff time. I'm a private doctor with my own hospital, but I give some time to a public facility. Sharing of equipment, theater time, theater space. We have a long waiting list in a public hospital for surgeries, but can we actually use some of your theater time as a private hospital because we have a contract that allows us to do that? And a lot of them are not necessarily covered in the PPP laws, so they will not fit under a classical PPP contract. In late 2021, the Kenyan president signed into law a Public-Private Partnership Act. This new law has opened up doors for counties to get into PPP arrangements, and it's important that they start exploring this, but they also need to do this responsibly because getting into a bad PPP arrangement is actually more wasteful than not getting into any arrangement at all. So the popular version is ready, and it will actually be launched and shared during the Health Expo. Welcome to Strathmore University. We'll be hosting the Health Expo on 25th to 27th of May 2022, and we'll have a panel discussion discussing some of the policy, legal and regulatory aspects and how those affect or hinder or facilitate successful public-private collaborations and partnerships.